Hello everyone, and welcome to another very fun and interesting Case of the Month session. We have a 40-year-old female patient, and we actually have a post-transplant biopsy of this patient, and they're asking if there's rejection because the patient has acute kidney injury or failure. She's been transplanted 6 months ago. In the time in between, she's had complaints of dysuria from time to time, and I think a couple of courses of antibiotic treatments. And as for her history, it's said that the end-stage kidney disease of the native kidney developed due to recurrent attacks of acute kidney injury again. And there are two biopsy procedures, apparently, which were reported as acute tubular interstitial nephritis, and that's all we kind of know of the patient. So when we received this biopsy, this was very interesting under the dissecting microscope, because you could see that there was this black pigment all over the tissue, and I was really surprised by it. Let me zoom in here, as you can see, and I immediately phoned the nephrologist to ask if maybe there was some sort of procedure where she was injected with something, or if she ate or drank something, and they said nothing. There was nothing of the sort. And then the next day, we examined the sections, the histological sections. And here again, even under the microscope, you can also see these areas of what looks for now like black pigments all throughout the biopsy core. And I'm going to zoom in a minute. So let me just quickly switch back. Let's get closer. As you can see, there's a lot of inflammatory reaction as well, and acute tubular injury as well. But you've also got these kind of brownish tinged, and what you can discern to be crystals when you zoom in within the tubular lumens. They're like blocking them. They're in aggregates, the really larger ones, but you can also see them as smaller final crystalloid structures within the tubular epithelial cells over here. They're like various shapes, but they're definitely crystals with this magnification. Here you go. These are probably, some of them are denuded epithelial cells that are also stuffed with the crystals. And they have this brownish yellowish tinge. Here you can see them in aggregates. In fact, here they are again. You can see that they're angulated here. Some of them are more like, the aggregates are like round shaped. Others are, well, no particular shape. Let me continue. And it's like all over the biopsy sample. There's accompanying acute tubular injury, of course. And here they are. And there's foreign body giant cell reactions as well. In fact, some of the giant cells are engulfing them, these crystals. Here you can see them over here. Here they are again. So from the medulla to all the way to the cortex, you see these aggregates of crystals. When you look at them under the trichrome stain, they're light blue, very faint blue there, as you can see. Here they are. They stain black with the silver stain. Here they are. And I'm going to try and polarize, but this microscope, with this microscope, it's not really that easy to polarize these structures. I'm going to try and show you that they are birefringent under the polarizing filter. Just a second. Right, let me just show you. I'm also going to show you pictures that I've taken, because this microscope is not very good at polarizing because it's multi-headed. There, well, you can partly see it, see? You're going to have to see over here. As you can see, they are birefringent, and I'll show you the pictures that I've taken. See, it was like a starry sky, and you could see the huge aggregates, and you could also see these tinier, very fine granular deposits within the tubular epithelial cells. It was all over the biopsy specimen, these crystals. And these are actually crystals due to a metabolic defect to a dehydroxyadenuria. And we proved that with genetic tests, which showed that the patient had a homozygous pathogenic mutation of the APRT gene, which codes for this enzyme which is involved in the metabolism of these alloprenol, and you can treat these patients with, actually I meant they're involved in the metabolism of, I'm going to say the metabolic pathway that converts adenine to 5-AMP. Okay, there it is. I found it. And you can treat these patients with alloprenol, which results in excellent prognosis if the patient is started on treatment before renal failure develops. So I thought I'd share this case so we all keep in mind that if we do see these brown yellowish tinged crystals, which are kind of like oxalate, but then they have this pigment, especially in macroscopic examination, you can see that they're actually black. And in contrast to oxalate, again, you can see them as fine granules within tubular epithelial cells as well. And that if you once see it once, it's something you won't forget, and you can actually diagnose. And hope you enjoyed this case.